Hi everyone, I'm Carrie Chevarelli. I'm an Austin-based physical therapist and the owner of Healing Foundations Physical Therapy. I am also a breast cancer survivor, having gone through treatment with chemoradiation and deep flap reconstruction. Happy to be providing some video footage to hopefully help you in your journey of recovery following surgery. I will say, please consult with your physician prior to doing anything that you see in these videos to make sure that it's safe for you and that you've been cleared medically before performing any stretching or modalities of choice. Thank you. Yoga-based stretching is often helpful as you're recovering from breast surgery because it allows you to very slowly and gently allow yourself to stretch and breathe and relax all at the same time. The child's pose stretch, you lean forward and rest your head on a pillow, and then you let your arms walk forward towards the top of your yoga mat until you feel a stretch coming under your arms across the front of your chest. Spend several deep breaths wherever that point is that you feel that stretch before walking your hands back to the starting point. You can repeat this a few times. The important thing to remember is to move with your breath so that you maintain a relaxed and effortless stretch. Please note if it's not comfortable for this degree of knee bend, you're also more than welcome to place pillows between your hips and your heels to elevate yourself, or additional pillows under your forehead. As with any stretches, please be safe getting on and off the floor, and if you've been advised to not be on the floor, this may not be the stretch that is the best for you. Once it's comfortable for you to have your hands over your head, you can start to move your hands side to side to move your stretch down the side of your chest wall to a more lateral area, which is also oftentimes tight following breast surgery. Tasha is walking both of her hands towards her left side and going to spend 3 or 4 breaths there, coming back through the center, going towards the right side, taking nice deep breaths as she's moving, and stretching just to the point of stretch, not to pain. As with the other position, if a pillow is needed for comfort either under the head or between the hips and the heels, it's still a very, very good way to stretch. Make sure that you are safe and that you're comfortable while you're doing this. The use of props for helping to stretch and open the anterior chest when someone has gone further out from their surgery is oftentimes very helpful to add a little bit element of additional stretch. In this case, Tasha is laying on a half foam roll that is a standard length. She has her head on the roll as well as her tailbone. The head needs to be supported down through the spine on the roll. She's going to do snow angels on the floor, raising her arms and rotating through her arms overhead and then coming back down to help open the top of the chest, the shoulders, and the front of the chest. This is an active stretch. However, if you find that at one point in the range it is especially tight, you're more than welcome to pause and hold your arms at that level for a few seconds, breathing through your stretch. Be patient as you do this stretch. For some people, simply laying on the half roll is a stretch without moving your arms. So be gracious and be patient with yourself. One of the most important things you can do during your recovery process is to take time to relax and meditate. Numerous studies have shown the benefit of this, and it helps with pain control, pain management, and also just general sense of well-being during the journey. The position that Tasha's in with her legs on the wall has automatically reduced the fight or flight response in her body because her legs are elevated. She's very flexible, so her hips are very close to the wall. However, she would have the same benefit even if her hips were further away from the wall. In this position, the low back is allowed to relax, the chest is allowed to relax, the neck and head are also allowed to relax. The arms are simply by the side. She can also modify this position by bringing her feet slightly apart on the wall or even wider if that's comfortable. And she can also bring her feet down so that they rest comfortably on the wall. I hope you found these stretches to be helpful for you as you recover from your surgery. Please remember to consult with your doctor and heed any post-op instructions that they may have given you prior to performing any of these techniques that we've shown you. Make sure that you keep yourself comfortable and safe. Make sure that you heed any sort of warnings or safety measures that you need to. Thank you for watching this, and I wish you the best of health.